Assalamu alaikum. Next topic is urethritis. Urethritis is inflammation of the mucosa of the urethra. Types: number 1 is meatal ulcer, number 2 is urethritis. It may be gonococcal urethritis or non-specific gonococcal urethritis, Ejaz disease, and periurethral abscess. The first is ulceration of the urethral meatus. It is complication of neonatal circumcision, developed 2 years after circumcision due to devascularization of the frenulum artery by ligation causing scab formation, blocking the meatus, leading to bleeding and blood clot, difficulty in passing urine, fibrosis, formation, and acquired pinhole meatus. That is, there is a small opening in the urethra, that is, the whole of the urethra is very small, pinhole like. Treatment is meatotomy. Meatotomy is to open up the meatus. Then gonococcal urethritis, cause is Neisseria gonorrhoeae, which is a gram-positive diplococci, kidney-shaped, infects anterior urethra in men and urethra and cervix in women. Symptoms include urethral discomfort and discharge, investigation, urethral smear, pus for culture sensitivity, and PCR. Complications include pelvic inflammatory disease, infertility. If mother has gonorrhea, then the child has to be born by cesarean section, because if the child is born by normal birth, while passing through the birth canal, the child develops blindness. Therefore, it is always must that all mothers having gonococcus infection, they must have cesarean section for the delivery of the baby. Besides this, there is posterior urethritis, prostatitis, epididymoarchitis, iridocyclitis, endocarditis, and sepsis. Treatment is antibiotics, ceftriaxone, ciprofloxacin, and penicillin. Non-specific urethritis or non-gonococcal urethritis. Etiology: it is a sexually transmitted disease due to chlamydia trachomatis, urea-plasma urealytica, or mycoplasma genitulum. In 50% cases, the cause is unknown. Clinical features include men dysuria, purulent discharge occurs for 6 weeks after sex. Women develop vaginal discharge. Investigations include urine for contained threads, pus cells, PCR or culture sensitivity may be done. Complications: epididymitis, urethral stricture, urethral trigonitis, cervicitis, and pelvic inflammatory disease. Treatment is antibiotics, oxytetracycline, doxycycline, azathioprine. Note: treatment of both partners should be done to prevent reinfection. Ejaz disease or sexually acquired reactive arthritis. It is an autoimmune disease triad of urethritis or diarrhea, conjunctivitis, and polyarthritis. Etiology: chlamydia cause urethritis, gonococcus urethritis, salmonella shigella, campylobacter cause diarrhea. It is a HLA-B27 associated disease. Symptoms include conjunctivitis, arthritis, usually 3 weeks after the infection. Investigations: pus for culture sensitivity. Treatment is antibiotics and anti-inflammatory drugs. Periurethral abscess. It can be penile, bulbar, or chronic. Penile urethral abscess, it arises from the acute gonococcal infection of the gland of Litter. It is tender, discharge is present, and induration or under surface of the penis. Fistula may form. Treatment is anterior urethrotomy. Then bulbar urethral abscess. It is cellulitis caused by streptococcus and anaerobic infection. Clinical features: fever, perineal in pain, rigors, tachycardia, tenderness, swelling. Treatment is antibiotics, incision and drainage, and suprapubic urinary catheter. Thank you. The reference is Short Practice of Surgery by Bell and Love, 26th edition.